Assalamu alaikum. How are you, students? Today, our topic is evaluation of the children's psychomotor development of different age groups, semiotic main clinical feature of the psychomotor development. So we will add today the factor affecting psychomotor development is the genetic, hereditary, chronic disease, education, social environment, and material and living conditions. The sixth one is care, which psychomotor development affect. The second thing, criteria for assessment or neuropsychic development is you must check the motor skill of the patient, statics and his balance, conditional reflex activity, speech, higher nervous activity. Motor skill, purposeful manipulative activity of the child. Purposeful manipulative activity of the child is known as motor skill. The development of motor skill is newborn physiological muscular hypertonicity, limited movement, chotic athetosis like worm. 2-3 weeks, the coordination of eye muscle fixation of the bright object. 4 months is manual activity start. 4 to 5 months of the child coordination of the back muscle rolling from back to stomach. End of the first year is purposeful walking. So after this, motor activity is increased from 2-3 months of lab. The ratio of active periods is sleep is first 4 months 1:1 ratio, from 5 to 8 months 1.7:1 ratio, from 9 to 12 months 3.3:1 ratio. Statics is this is the fixations holding certain parts of the body in the required position. It's known as statics. It means the balance, how the child being walking the step like process for his future. The development of static like holding of heads 2-3 months. The baby in the sitting support 6 to 7 months. For example, like this. The third sign is the child is standing in 9 to 10 months. In the 12 month, the child will be walk. After walk, the child will be talk. Then we go for conditional reflex activities and adequate response. Adequate response to irritating environmental factors and one's own need. One's own need जो होगा उसका उसमें करेंगे. Stages of development of conditional reflex activity. 1-2 weeks negative emotion in the form of a cry. 3-4 week positive reaction, the phenomena of oral attention. 1.5 to 2 months smile as reactions. 3 months a complex revitalizations, emotion of joy, negative emotions, screaming and whimpering. 3-6 month emotional reaction to toys, formation of temperature, and 6 to 12 months complication of the negative emotion mother loss syndrome. Again, we come to 1 to 1.5 years, high activity of the emotional life, weakening of negative emotions, and the emergence of whims. To 4 years, feeling of fears and horror, loss of mother syndrome, empathy, and 4 to 6 years is the second period of fearlessness. The speech development is, there is also stages like preparation period, sensory period, motor speech period. The preparation period is pronunciation of the guttural sound, 1 month, 2 to 4 months, hum, buzz, 6 month babbling and prattle sound. Sensory period is development of the sensory speech, 7 to 8 months. Motor speech period, 12 months, 8 to 12 words. 12 to 18 months, simple sentence, judgment, formation of the proposals, positioning yourself as a person, comprehension of relationship, objects, events, memorization, and listening. So these are coming the 3 to 5 years. At 2 to 2.5 years, the vocabulary of child increases to 200, 300 words, simple sentence appear in speech. The timing of the formation of the motor speech is different, which does not show the peculiarities of the children's intelligence. So sometimes intelligence is also related with speech, like speech and intelligence. So unconditional reflexes is persistence, are reflexes, transients, and sitting reflexes. These are reflexes, for example, persistent. If you go for persistent, So persistence is sometimes we can say continues throughout life, but some persistent is for long durations. They will regress slowly. For example, swallowing, corneal, conjunctival, superciliary, sneeze reflex, yawn reflex, cough reflex, gag reflex, and tendon reflexes. Again, we come for the transient reflexes, physiological, which are for short-term durations during infancy. There, after that, they will go oral medulla, spinal cord, and myeloencephalon, which is known as medulla and spinal cord. So we can say also postonic reflexes to them. Oral reflexes like sucking, search engine routing, cosmal reflex 3 to 4 months, sucking 10 to 12 months. Infant begins strong sucking movements in response to stimulation. Persist throughout infancy even without stimulation during sleep. When we touch the corner of the baby's mouth, the baby will turn his head and open the mouth in directions of the stroking. For example, like this second picture. So you can say the second picture, which is known as cosmal reflex. Oral reflexes is known as proboscis to 3 months. When gently tapping the child lip with a finger, he pulls them forward in the form of proboscis. Like for example, you're doing like this to child. Palmar mouth head Babkin reflex. 2-3 months they are occur in Babkin reflex. They contain three things: palmar will be grasping, and mouth will be open, and head will be tilted to one side. Pressing the tenor of the palm causes infant to open the mouth, turn the head toward the chest, disappear 2-3 months after. Spinal cord is protective, 2 months protective reflex, support reflex, stepping reflex. 2 months, and 2 months. Now protective when the infant is placed on abdomen, he turns the head to left to right side. Support reflex when the lowering the child to hard surfaces, rest his legs tightly, bending them. For example, this picture. Stepping when the supporting reflex is examined and the body of the child toward the child will make a stepping. For example, they will take step by step. Grasping is we can say Robinson reflex. In 3 months, they are occur touching the palm of the hand or sole of the feet near the base of the digit causes flexion of hand and toes. Hand and toes also. So motor reflex, you can see the second picture, the 4 months of child is in response to sound, sudden movement, the baby towards throw back his head, extend out of the arm and legs and cries, then pull the arms and legs back in. Like arm will be like in this position and our arm will be extend out arms and legs. Again, we are come to Kernig reflex in the 4 months. Kernig reflex is known as when the infant leg is flexed the knee hip joint. Flex in the knee hip joint, doctor cannot extend the leg in the knee joint completely. Burrow reflex, crawling reflex, you can say, in 4 months also occur with the infant is placed on the abdomen, pressing gently on the sole of the feet causes crawling movement. Babkinski sound present, plantar reflex, Babinski reflex. So again, we say the Babinski reflex are these reflexes of 4 to 6 months occur, stroking the sole of the foot from the heel along the ball of the foot, causes toes to the hyperextend the big toe of the dorsiflex. Like you look hyperextend of the big toe and you will make like the L shape, but opposite L, for example, you come from the back side on the lower side and you turn to the right side. It is disappear at 1 year of age. Spinal reflex, Gallant reflex is 3 to 4 months, stroking the infant back to along the spine causes arching the back in the form of kyphosis. It disappear at 4 weeks. Reflex periods, also known as 3 to 4 months, stroking the infant backs along the spine from the sacrum to the neck. The infant responds by crying, flexing the extremities and relativing the pelvis to the head. Lordosis of the spine, you can see lordosis of the spine, bending of the spine to one side, and maybe defecations and urination can cause. So after these are also symmetrical cervical tonic. These are myeloencephal medulla and spinal cord toward postonic reflexes. When the infant head is turned toward the chest, the arm reflex and the leg extend. So it did disappear at 2 months of age. It disappear. Asymmetrical cervical tonic reflex, we can say, when the asymmetry unequally of the body, symmetrical equal of the body. When the infant head is quickly turned to one side, the arm and leg extend on that side. When the position arm and leg is flexed, on the opposite arm and legs flexed, it disappear by the age of 2-3 months of age. The reflexes are absent in the newborn and appear during infancy. Upper lando reflex and lower lando reflex appear round formants. The secondary reflex, when an infant is placed on the abdomen, the raises the head and look for a visual references and stretches the trunk. You will be see the concavity on the back side, concavity, and convexity on the abdominal side when you place your hand. The writing reflexes are absent in newborns and appearing during infancy. Lower lando reflex appear for 6 months. When an infant is placed on the abdomen, he raises the head and lift his leg. For example, like this position, he will support his chest and his head by his arms, and the legs will be extended at the back. So with normal reflexes disappear on time. Lack of reflexes at that required age is a sign of delaying, and reflexes are pathological if a child has a place at the age at which they should be absent. So students, so general rule for determining all these reflexes in a warm room, keep the patient in a warm room. 1 hour after feeding, you must ask from the mother she should feed her baby or not. She should feed her baby or not. First, the state of all 5 criteria is run through, then assessment of the unconditional reflexes, starting with the posture on the CN, then on the stomach, and last of all, in the upright position. Disorder of neuropsychic development is debility, impassibility, idiocy. So, debility is a mild degree of mental retardation, as well as moderate mental retardation is imbecility, and a severe degree of mental retardation is idiocy. The patient does not adopt the environment, especially social. Especially, the patient should not adopt the environment, especially social, to sell services, does not speak phrasal speech, or does not speak at all. Convulsions, semiotic disorder of the psychomotor development is convulsions are intermittent muscle contraction of various durations, intensity, and localization tonic with prolonged spasm clonic alternation of the rapidly changing movement, muscle contraction with relaxation, and clonic alternation of the rapidly changing muscle contraction relaxation. Decortical syndrome also, the disappearance of the acquired motor speech mental skill, the appearance of the symptom of oral automatism mental retardation. So decortical, it's mean the cortex will be involved of the brain, and decerebration syndrome as the persistent decerebral muscle rigidity, extensor position of the limbs at thrown back strabismus. Also pathological reflexes are the oral automatism. So the next question is CP child. CP child is known as the non-specific neurological group of the genesis, which is violation of the early stages of the brain development. Cerebral palsy is manifested by the following clinical sign: violation of movement, inability to keep a normal state, inability to perform voluntary actions, a violation of the psyche, speech, vision, hearing, a spasm syndrome. So anencephaly is also the psychomotor disorders. Absence of the brain in the skull. A child without a brain, anencephaly is in Y above. So hydroanencephaly is the presence of cavity filled with liquid instead of a large hemisphere. There will be liquid, all filled by this liquid. This is known as hydro. And goloprosencephaly is known as the fact the brain is not divided into hemisphere. The ventricle of the brain are located in the cavity. The last case we will see the meningitis is a highly lethal lesion of the brain membranes of the inflammatory genesis. Meningitis may be purulent and serious clinical signs of the meningitis is high grade fever, vomiting, severe headache, head through burning back, and bad presence of meningeal symptom, Kernig Brzezinski sign, rigidity of the occipital muscle. So all these are connected with neurological syndrome also, like encephalitis, meningitis. A meningitis have 3-4 common causes like meningococcal meningitis and pyogenic meningitis are also bacterial meningitis. In 2 months of child, they are caused by E. coli, Streptococcus pneumoniae also, and Staphylococcus aureus. In the third year, in the second year of life, after second year of child, the meningitis will caused by Streptococcus pneumoniae and Haemophilus influenza type B viruses. In the third case, from 5 year to 21 year of child, they are also caused by Neisseria meningitis and Neisseria gonorrhea, which is caused also gonorrhea. And after also occurs Streptococcus pneumoniae and H. influenza type B viruses. So thank you guys. For the next class, we will share again the neurological symptom with you. So for today, thank you and Allah.